and then we'll go from there. Okay. Well, welcome everybody to this webinar. We're really excited to be hosting some resources for the industry on healthcare. We know that this is something that a lot of our industry partners have been looking into and are interested in. So we're really excited to have these experts on board with us to share this information. I just wanted to get started with a couple housekeeping items. So first off, we're just asking that everybody mute themselves if they can, just to avoid any background noise as our presenters are talking. And then as you have any questions, we're just going to plan to have a Q&A at the end, but feel free to drop any of your questions into the chat box on the side, just so that you don't forget what it is as items surface, and we'll be sure to address them as we go through the webinar. So with that, the two presenters just want to introduce. So Alia is the director for United Health Group, and she is our main point of contact for all things healthcare in this program that we're rolling out with UTIA. And then we also have Nick as well, who's the manager of sales with Teladoc Health. He'll talk to us a little bit about those resources after Alia does a quick overview of all of the general health options that we have. So with that, Alia, I'll turn the time over to you.
Thank you so much, Natalie. Hi, everyone. Thank you so much for being here. We're really excited about our partnership with the Utah Tourism Industry Association. And as Natalie said, I'm gonna run through our programs on a pretty quick basis, but they're all on the website in case you need more information. Give me a second here. I'm gonna share my screen. See if I can figure out how to present. All right, can you all see that? Thumbs up.
Looks good.
All right, great. So we are really excited, as I said, to partner with the Utah Tourism Industry Association to offer some great programs for the hospitality and tourism industry. Some of you may know United Healthcare, which is our health insurance program, but we're so much more than that. And especially in the past year and a half, we've expanded to take into account this concept of whole person wellness. It's not enough to just take care of your employees' physical health anymore. There's so many needs on the mental and social health spectrum. And so we're here to help you with different programs. Some of these are employer sponsored and some of these are purchased directly by the employee. And I'm going to go through a bunch of them today. So why did we do this? Why did we expand beyond just health and wellness? Well, we know that employers have been crippled by a pandemic, and now you all are in a labor shortage. So we're doing our best to try to help you attract and retain quality talent. We also know that the workforce right now is pretty discerning, and they're looking for affordable and accessible options when it comes to health and wellness. Health benefits are in the top 2 benefits that employees look for when considering where to work, right behind compensation and right before culture. So it's really important that we enable you to provide resources without breaking the bank. And then there's also this segment of the population, part-time and seasonal workers, that you need to run your businesses effectively, but traditionally they haven't had access to health and wellness benefits. So now we've got a variety of different options for every size business to meet your employees' needs. Okay. So as I mentioned, we've got a number of different programs available. Just trying to hide the boxes that are blocking these, but I'll go through all of these in a little bit more detail. We've got our health insurance program, our employer-sponsored health insurance from United Healthcare. We've got individual and family health insurance that we just launched, we're really excited about. At-home diagnostic tests with our partner at Let's Get Checked. We've got a free prescription discount card, free mental health resources, and we also have probably the most exciting program, Healthiest You by Teladoc, and we've got Nick Gates with Teladoc to review that for us after I run through these others. So really excited, whether you're a member of Utah Restaurant Association or the Utah Tourism Industry Association, you have access to all of these programs at a special member price. Okay, So we'll start at the top with employer-sponsored health insurance. I know many of you are looking at your health insurance options as we go into 2022. So we hope that you ask your broker for a member quote. As a UTIA or URA member, you get access to some special pricing. And we even have some new benefits for restaurants, bars, and hotels to help you get back to work and help you when it comes to providing health insurance for your team. So again, we just hope that you take a look at these and see if we might be a good fit for your business. As I alluded to, we just launched our individual and family health insurance. This is so exciting because now we're able to offer something to those mom and pop locations, or say you're just looking for insurance for your family, it's just your family that runs the business, or for those employees who traditionally haven't been eligible for employer-sponsored insurance. What this is a great service that you can pass on to your employees. So by going to this website or calling the dedicated phone number, our team will walk your employees through a variety of different plans that are available from multiple carriers. On the phone, they'll be able to give them advice as to what plans they should consider. They'll be able to enroll them right on the phone for medical insurance, as well as dental, vision, life, accident, and critical illness. And then if your employees are eligible for any federal subsidies, they can enroll them right there too. This is such a great benefit. Again, it's no cost to the employer. You can just pass this on to your employees, stick it in the onboarding kit. And you may be wondering, why is this more beneficial than telling them to go to the exchange? Well, we've actually got plans that are on exchange and off exchange. So we're providing a service to your team to really help guide them through this process. We know it's difficult, it's clunky, so we're doing everything we can to help the industry get covered this year when it comes to health insurance. The next program I want to talk about is our Let's Get Checked program, which is at-home diagnostic tests. You may not know that 70% of medical decisions depend on diagnostic tests, and most people don't get the tests they needed. I know I personally right now have a hard time going into the doctor's office or getting labs done. It's inconvenient. My schedule's busy. If you work in hospitality or tourism, your schedule may not coincide with traditional hours. So now what we've got is this program with Let's Get Checked, where you can order these tests online at a discount and take them on your time at your convenience, send them in, and then results will come back to you. We've also got COVID-19 Pcr tests in case that's of interest. This is one of those programs that is individually purchased. So as an employer, like I said, you just stick this in your onboarding materials, in your benefits package, and you're promoting a culture of care. You're really telling your employees that it's important that they take care of themselves, and you're giving them resources to do that without adding to your bottom line. The next program I want to mention is our pharmacy discount program. This is so great. There's no registration, no cost at all. You just go to the website, download the card, and it saves the average household $300 a year. We all know that prescriptions are so costly. So this is a way to try to help the industry afford their medications. Again, there's no registration, so you just show the pharmacist and they apply the discount. So this is a great free benefit that you can start taking advantage of today. And then the other program that's been a huge priority for us and will continue to be is mental health. We know that the industry's been struggling, and we know that 1 in 5 Americans live with a mental health condition, and most of them aren't getting the care they need, either due to stigma or accessibility. So we're working on different ways that we can address the issue and enable employers to provide resources to your employees. We have free apps, we have free support groups, and we even have a free guide for managers when it comes to dealing with mental health in the workplace. And we're happy to provide all of these to you at no cost. The other thing that I'm really excited about, and probably the most exciting program that we have to offer, is Healthy as You by Teladoc. And I'm going to turn it over to Nick Gates with Teladoc to walk you through the program today. Nick, are you there?
I am. Thank you so much, Alia. And I'm going to go ahead and share my screen. So when you see my presentation, just give me a thumbs up. Fantastic. So my name is Nick Gates. I'm the manager of sales here at Teladoc Health. Myself and my director, Andrea Sadler, we manage the strategic partnership between Teladoc Health the National Restaurant Association, and their joint venture with United Health Group. And the single goal of that partnership is to really offer affordable healthcare access to the entire hospitality and tourism association industries and their employees. And a little bit about our organization. So Teladoc, we were formed in 2002. We were one of the very first telemedicine organizations, and we're currently 19 years old. 2015, we became the very first publicly traded telemedicine organization on the New York Stock Exchange. Our ticker symbol is TDOC, and our current valuation's right around $22 billion. We have about 4,000 employees worldwide across 20 different countries. We serve over 40,000 employer clients, of which over 50% of Fortune 500 companies use us for our telemedicine services. And we're proud to have over 70 million members that have access. So we're truly the global leader in virtual care. But as Ali alluded to, there's a labor shortage that's happening within the hospitality, and I'm sure in the Tourism Association as well. And it's real. So there was actually a company called Joblist that did a job market report that they released back in July. It surveyed over 30,000 job seekers from across the country in the second quarter, and they asked them one question. Would you consider working in a restaurant, bar, hotel, or other hospitality job for your next job? And 60% said no. In fact, 38% of the hospitality workers the former hospitality workers that they surveyed, so that they wouldn't go back to the industry either. And so obviously those numbers are shocking, but I think what we really need to dig into is the reasons why. So pretty common reasons as your top three. Most employees, they just prefer a different work setting. So, unfortunately, you probably can't offer them a corner office with a desk or a computer. And so you really can't touch this work setting outside of culture. But you do have control over pay and benefits. So historically, hospitality employers haven't offered healthcare benefits, mostly because you're under the 50 full-time equivalent benchmark where you would be required under the Affordable Care Act to offer healthcare. You have a large number of variable hour and part-time employees that wouldn't be able to participate just based on the number of hours that they work. Of course, cost of healthcare tends to be the number one driver for employers not offering it because it's the second most expensive line item to payroll. And the majority of hospitality and tourism employees, they tend to skew younger, where the average age is right around 31. So even if you did offer full health insurance to those employees, they may not participate due to the cost. They prefer to use that money elsewhere because they're young and resilient and healthy. But COVID's really highlighted the inequities within our healthcare system. And so most employers are reevaluating their benefits package and not just focusing on offering health benefits to the full-time employees, but also the part-time and the seasonal, because everyone should have access to healthcare. But not just physical healthcare. We need to focus on the whole person and offer a substantial amount of mental health resources as well. So specifically in the hospitality industry, 17% of workers have been diagnosed with substance abuse disorder. So there's an immediate need for access to mental health care resources in addition to physical health resources. And that's really where virtual care helps fill in the gaps and provides you the high quality access that's not only affordable, but also ticks the boxes of everything that employees would need from a healthcare benefit. And so we partnered with United Health Group and the National Restaurant Association to launch our Healthiest You Complete bundle. And this is an employer-sponsored virtual care offering that includes a full suite of services that we have through our virtual platform called the Healthiest You mobile app. So members will get access from everything preventative and wellness services with our nutrition and our neck and back care program, all the way to their everyday care needs and even their specialty care needs for mental health, dermatology, and our expert medical services. And we include this in an exclusive price point for UTIA members for $9 per employee per month. And then we extend that benefit to the entire household of the employee. So really affordable healthcare benefit that helps, that could potentially put you on a much better level playing field to be able to attract new talent and obviously retain the people that you're trying to hold on to right now. So as I'm sure you guys can relate, it probably doesn't jump off the screen as far as how members are going to access the services. So I'm actually going to jump over to a live app demo. But before I do that, I want to make a couple notes. All of the services are available in English and Spanish. If members don't have a smartphone or tablet, we have an online member portal and a 24/7 call center that members can use to be able to get access to the services as well. In addition to English and Spanish, we do also partner with Language Line to support up to 240 additional languages through their translation services. So we don't want technology or language to be a barrier of people getting the healthcare that they need. So I'm going to hop over to the app, and then we'll just take a deeper dive into each of the services. So give me just a second. And Natalie, can I get a thumbs up if you see what looks like a phone screen? Awesome. So when you first log into the HealthySU mobile app, you're going to be greeted by your dashboard. And this is what's going to show any upcoming visits that you have. So you can see that I have 2 mental health visits that are coming up next week. Where most people are going to start their journey with us is actually with the Request a Visit Now button in the middle. So I'm going to go ahead and tap that. And you'll notice that this is 3/4 of my family. It's myself, my 2 boys, my wife, because she's over the age of 18, she has her own profile, but there's no cost for her to use all of the services that are in the HealthySU bundle. So I'm going to switch this over to the state of Utah. So everything is relevant to your state. Now, 4 of the 6 services in the HealthySU Complete bundle are right here in the Request a Visit Now function. So all of the services, there's no cost to use them. So everything is free and unlimited to use. We're going to start with general medical. This is what we've been doing for the last 19 years. So it's where you can talk to a doctor via phone or video 24/7, 365. We have over 12,000 physicians that operate our general medical service, and they allow our members to talk with them via phone or video. So I'm going to go ahead and select a phone visit, and you'll notice the wait time in Utah is between 10 to 15 minutes. So to put that into perspective, to speak to a physician in person, you're going to spend on average about 2 hours worth of time, and we can take care of over 70% of the reasons why you would go to a doctor in person in that 10 to 15 minutes. So a fraction of the time in comparison to going in person. And we allow our members to either do an on-demand visit, or you can schedule a visit up to 48 hours in advance. So if you have a break, or maybe you want to schedule a visit on your day off, you can do so at the appropriate time and date that you'd like. I'm going to just move forward with an on-demand visit. Now, because we chose a phone visit, we want to make sure that the provider has the most accurate phone number on file for the member. And so we give you the chance to update it right here. Our doctors will be calling from a blocked phone number. And so we want to make sure that we notify the member via text or email ahead of their call. So you can opt into those right here on this screen as well. We're just going to ask the member to tell us why what's their concern today. So you'll see things like cold, cough, earache, flu symptoms, but maybe they forgot their hypertension medication when they went on vacation. We can offer an emergency refill of a prescription within the app as well. So I'm just going to go ahead and say that today I have a cough. If I had maybe pink eye or a sore throat, I can add photos to help the doctor diagnose me properly. We've never had a data breach in our 19-year history, and our app is fully HIPAA compliant. So anything that you upload or indicate in the app is fully secure. So I'm going to go ahead and just say that I have a cough today and move forward with my visit. Our doctors can prescribe medications, and so we just have you declare a pharmacy that you'd like the doctor to send your prescription to if it's medically necessary. So I'm going to use 84101 as far as the zip code, and we'll just go ahead and select the CVS that's right downtown. And this is the receipt screen that you see. So every receipt screen is going to show $0 because there's no cost to use any of the services within the bundle. We just have the members select and answer one more question. That's where would you have gone if you didn't have access to the HealthySU virtual care services? And we know that most people in the hospitality industry, they tend to work outside of the normal 9 to 5 work hours. And so they overutilize things like the emergency room and the urgent care. And so we asked this question to help validate the fact that we can offload and redirect unnecessary use of the emergency room and the urgent care facilities. And we provide monthly reporting to our employers that showcase how your employees are utilizing all of the services within the bundle. So once you answer that question, you're going to check a couple consent boxes and hit confirm, and you'll be in the queue to have a doctor to call you within 10 to 15 minutes. The next service within the bundle is our mental health care service. We're extremely proud of the work that we've done to fill in the gaps of the mental health care system. So 64% of counties have a shortage of mental health providers, and 55% of counties don't have access to a single psychiatrist. So virtual care really does fill in the gaps of care for people to get access to the mental health care needs that they have. So here at Teladoc, we have over 2,500 mental health providers that are therapy level and over 500 psychiatrists nationwide. And we want to make sure that people get access to quick access to a large list of providers to be able to get the mental health care needs that they have addressed. And we let them choose from a wide variety of providers. And so here's a sample of the ones that are available in the state of Utah. You'll see psychologists, licensed professional counselors, clinical social workers, marriage and family therapists. You can actually go in and filter based on gender, language, and any one of 44 different specialties to find the right provider. And what's great is once you start a relationship with a provider, so for example, Bill McFeature, you're going to have unlimited visits with that same provider at no cost. So we'll just have you declare the reasons for you to seek mental health care. So we know that right now, 40% of Americans have diagnosable symptoms for depression and anxiety. It's been one of the biggest drivers for people using our services. And it's a direct result of COVID. But we can have our members do phone or video visits with their provider. And here we're just going to have the members select a couple dates and times that work for them based on the availability of the provider. So he was available on Mondays, and we'll just select 3 dates. And he's going to respond back within the next 24 hours with what date works best for his schedule that's within the 3 that you chose. A lot of our providers will have what's called slot scheduling, where you can select a date and time that they have availability and have a guaranteed time slot. This provider, they just have a little bit more flexible timing. So once you select the dates and times, you'll actually be prompted to fill out what we call our emotional health questionnaire. And this just helps set the baseline of where you're at clinically and emotionally. So I want to bring your attention to one question, which is question number 11. It's thoughts of actually hurting yourself. So if the member selects anything other than none, it's going to prompt them to reach out to a suicide hotline. And if they don't reach out to the hotline within 48 hours or 24 hours, the hotline is going to reach out to them using the phone number that's in their profile. So it's not going to prevent them from scheduling the visit with the provider that they chose. It's just going to provide that immediate resource, knowing that we can't see them right then and there in that moment of crisis. So once you finish the questionnaire, you'll hit continue. You'll be greeted by the same $0 receipt screen, and you'll have a scheduled visit once the provider confirms the date and time that they're available. So that is mental health. The next service within the bundle is our dermatology feature, and it's actually my favorite. So I have a 1-year-old that has eczema. And so every month I go in here, and instead of having to go and see a dermatologist or have a consultation face-to-face with them over the phone, we actually know that most skin conditions can be diagnosed via photo. And so that's what we have our members do. So in my case, with my son, I go in here every month and select that he has a rash, because eczema is a form of rash, fill out this questionnaire, and then I provide 3 photos for the dermatologist to review. And we guarantee that a dermatologist is going to review the case within 48 hours. And every single time that I've used this, which is monthly, I've gotten a response back within 1 hour. And I'm usually getting a notification from the pharmacy indicating that they have my son's prescription grade hydrocortisone cream waiting for me. And the quickest time that I got a response back was 7 minutes. So even though we guarantee 48 hours, it's happening a lot quicker that people getting responses. Now, I also think of teenagers that may have things like acne. So instead of having to wait 6 to 8 weeks to go to a dermatologist in person, you come in here, fill out the acne questionnaire, and you'll have a prescription for medication or creams available for you within that 48 hours or less. So really powerful tool from a dermatological perspective. The last service within the request a visit now button is actually our nutrition service. So we know that the food that you put in your body is the best preventative medicine. And so we want to provide access to a full list of registered dietitians. And so members can come in here similar to mental health and choose a dietitian that fits their needs. So if they're looking for general wellness, weight loss, maybe they're trying to manage a medical condition, you can find and filter down the providers based on those specialties. So you can do phone or video visits as well. And in this case, this provider does have the slot scheduling set up. So she has an appointment available as early as the 29th at 3 p.m. So most dietitians are really hard to get into without any type of referral from a physician. And they're typically about 8 weeks out. So the ability for us to get in next Friday is an incredible time as far as, as far as quickness to get access to care. Now, once the member selects the date and time that works for them, we're going to have them fill out a nutrition assessment. And it's going to include things like what vitamins and supplements that you're taking, and also just an overview of your current diet for breakfast, lunch, and dinner. And that's important because during the very first visit with the dietitian, they're going to provide a full meal plan for breakfast, lunch, and dinner for the member that's tailored to not only their health conditions, but any specific goals that they have. And because they're dietitians, everything is fully clinically backed. And so they're going to provide all of the resources from the Academy of Nutrition and Dietetics that supports the meal plan. And the members can have unlimited visits with the dietitian. We recommend, though, that you have at least quarterly visits to make adjustments to the meal plan as necessary. Now, the last two services that are included in the bundle are back on the dashboard. So let me back up here. And then we'll start with expert medical services. So expert medical services starts with a phone number. So Teladoc, we actually acquired a company called Best Doctors back in 2017. And Best Doctors is a network of over 50,000 physicians from around the world that are considered to be the top 3 to 5% in their subspecialties. And we engage with that network of physicians when members come to us with a major diagnosis like cancer, or if they've been recommended to have surgery. Now, cancer in particular, it's actually misdiagnosed 28% of the time. So it's imperative that people get a second opinion to make sure that they have the accurate diagnosis, and obviously they're put on the accurate treatment plan. So if a member comes to us with that diagnosis, we're going to collect all of their medical records on their behalf. We're going to retest all pathology, review all imaging, and we're going to send that packet of data to a physician in our network that specializes in that diagnosis. And 38% of the time, we're going to be improving the member's diagnosis. 79% of the time, we're going to be making adjustments to their treatment plan to more up-to-date treatments. And 95% of members that go through our second opinion service adhere to the plan that our doctor has recommended. So really powerful tool in those moments where you have a major diagnosis. The last service within the bundle is actually right here at the bottom. It's our neck and back care program. We partner with a virtual spine care clinic by the name of Telespine. And if a member comes to us with neck or back pain, they'll be paired with a certified health coach that has a master's degree in the orthopedic field. They also work directly underneath a physical therapist, and they're going to design a video-based exercise and stretching plan personalized to the member's specific pain. What's really great is once members go through their 4 or 8 week programs that typically range between 5 and 10 minutes a day of the exercises and stretches, 56% of members indicate that they have improved function. 58% of members indicate that they have reduction in pain. And their goals in organization is to keep people off of opioid medications, because 80% of opioids are actually prescribed for neck and back pain issues. So those are all of the services that are included in the Healthiest You bundle for that $9 per employee per month. But there's one more thing that I want to show you. So even though all of the services are no cost, if our doctors write a prescription, members will be responsible for paying that out of pocket. So we offer a prescription discount tool that's backed by GoodRx right here in the Healthiest You app. And so I'm just going to go ahead and search for the medication that my doctor prescribed. We'll just say that it was amoxicillin. So you can type in the medication right here. You'll see that the Target CVS has it for $3.99. So great, that sounds like a great price to me. And this is what the pharmacy will need to be able to offer that discounted price. Now, I always tell people, even if you have insurance, to price your prescriptions using our tool, because 7 out of 10 times it's going to be less expensive. So from end to end, we're watching the pocketbooks of our members. And so obviously having prescription discounts is going to be a huge win for everybody in your population. So all of that is included with the Healthiest You bundle. I wanted to just take some time and see if there's any questions that have come up from the presentation.
Nick, it's Alia. Do you think you can talk a little bit about how we're able to offer Healthiest You at such a low price? I know that usually comes up.
Yeah, so we often get asked, how can we do this for $9 per employee per month? Sounds too good to be true. Well, know that was a negotiated price point based on volume with our partnership with the National Restaurant Association, United Health Group. But Teladoc is more than just our employer, direct to employer sales channel. So we actually have a full segment of our organization that is focused on health plan business, which drives the majority of our revenue. as well as our hospital and health system business. And so if we're offering a discount to a small segment of a population within one industry, we're making up for that obviously with our direct retail business and our other channels of revenue as well.
Awesome, thanks. And I just want to add, this service has been so incredible and such a game changer. As I mentioned, mental health is a huge priority for us through our partnership. It's a huge priority for the hospitality and tourism industry. And I know personally, I've talked to employers. Unfortunately, I had an employer in California call me after there was a shooting on their property and they needed some counseling service. So they turned to Teladoc. I had another employer who was looking for some additional resources, not treatment resources, but support when their employees have struggled with addictions, substance abuse addictions. And so I realized this is not treatment, but it was an added value for the employers when we're trying to support the staff that we have. And remember, this helps alleviate workplace aggression. So, you don't want your employees coming to work if they're stressed, they're depressed, that kind of trickles throughout the team. It leads to not the highest quality experience for your customers. So just remember that as you look at these options. We hope that we can fit into your benefits package next year. And then I'll stop talking in case there's any questions.
I haven't seen any questions come through on the chat. So I maybe note too, a lot of you are muted. So if you are asking a question, you might be muted. Well, I think we'll leave it at that then. In the chat feature, I did drop a link to all of the resources on the UTIA website. And then for reference, we've recorded this webinar, so we'll be sure to share it with everybody. And that can include contact information as well, so that you can reach out to Alia and Nick with any further questions if you might have them. So thank you everybody for joining. We appreciate your time this afternoon and we'll see you later.
Thank you very much.
Thanks. Bye, everybody.